Hi, my name is Orchid Chong and I'm with Brandman University. Today I'm going to be showing you a comprehensive exam on my subject Sharon. This is for Nursing 604. So Sharon comes to the clinic today and she's here for a employment physical. Before she came into the clinic, we had the MAs take her vitals, her Snellen chart to make sure she has 20/20 vision, and if she doesn't, they work down what her vision is on per eye. And they also took her height and weight and they compared her BMI. So before I walk in the room, I want to make sure that we gave Sharon a nice private room with adequate lighting. When I walk into the room, I automatically notice that Sharon has a good sitting posture. She looks fairly healthy and normal. Her hair is even distributed. Her face doesn't have any noticeable facial edema or any deformities that I've noticed. I don't see any bruising or any bleeding on her. So first I'm going to go ahead and wash my hands, and then I introduce myself to Sharon. So hi Sharon, my name is Orchid. I'm going to be your nurse practitioner for today.
Hi Orchid.
Okay, so what brings you in today?
I'm here to do my general checkup and physical examination.
Okay, and then when's your date of birth?
December something.
Okay, and okay, so just to double check for patient confidentiality, make sure she has the right name and her date of birth. So now I'm gonna ask her a bunch of questions about herself, just so that way I could get a good physical background on her. And before this, I did look up some information on Sharon. Some past medical history that we have is that she had asthma when she was a child. Last asthma attack was when she was 5 years old, so she hasn't had an asthma attack since, and she hasn't needed any type of medication in about 10-15 years. Next is her past surgical history. She hasn't had any past surgical history at all, no wisdom teeth removal or anything, so she does have all her teeth there. She's never broken a bone either. No nuts, bolts, screws, or plates in her body. Next would be her social history. She does have a husband of 12 years, one partner, no external partners or external marriage affairs. Her social system, support system includes her family and some good friends that live nearby. She's really close to her parents as well and her siblings. For her family history, both her parents have hypertension, and on her maternal side, grandparents, they have diabetes. On her paternal grandparents' side, it's just hypertension. So that's her family history, and she doesn't have any cancer in her family that she knows of. No diabetes. She does have diabetes on her maternal grandparents' side, and then but the cancer, no breast cancer, no colon cancer that she knows of in her family. Next, we'll go into her allergies. So just to verify her allergies, Sharon, do you have any allergies?
No, I don't have.
Okay, no food, seasonal. Do you have any latex allergies?
No, I don't have any latex allergies.
And the most important, do you have any drug allergies?
No, I don't.
So we just double verify her her allergies overall. Next, I also know that Sharon takes some medication. It's a multi-daily vitamin, and I just want to double check with this with the patient, so that way I make sure that we're not missing any medications. So Sharon, do you have any prescribed medication to you that you take?
No, I don't have any prescription, but I only take that multivitamins over the counter.
Okay. Do you take any other over-the-counter medications?
No.
No birth control?
No.
Okay. So with that segue, we're also going to her OBGYN history. For OBGYN, she has a regular period every 28 days. She doesn't have any birth control. Her birth control method with her husband that they use is condoms. So she has a regular flow period. She doesn't have any crampings either. She has no concerns for STD since she's had her husband for 12 years. So next we'll also go into her psych background. So Sharon, do you have any history of mental illnesses?
No.
Okay. Do you have any depression or anxiety?
No.
And do you have any suicide ideation? Or
Absolutely not. No.
do you feel like hurting others or killing other people?
Nope.
Okay. So no homicidal ideation, no suicide ideation, no depression, no anxiety. Sharon, how's your sleep every night?
It's good. It's been pretty good. I've been sleeping like 6 to 7 hours a night, I think.
Okay. So her sleeping is good. We don't have any insomnia in that regard. Okay, Sharon. So I'm going to also go over some health maintenance as well.
Okay.
Looks like you work out, right?
Okay.
You run every day about 20 minutes.
Mhm.
Her diet is really healthy. She has toast and egg in the morning. Usually her lunch consists of a sandwich or a chicken salad, and usually for dinner she'll have some sort of rice and meat and vegetables. So her diet is very well balanced, and her exercise is good. When was your last flu shot?
A couple months ago.
Okay, so she's up to date with her flu shot. She is a student with Brown University, so she does have, she is up to date with all her other vaccines, and she has recently gotten a titer for TB, and that one is negative. Or the titer is positive. No TB. Okay, so then her last pap smear was last year in June of 2018, so she's not due, and that one came back normal, so that one isn't due for another 2 years. And her dental hygiene, she sees a dentist every 6 months. And no cavities, no root canals, and no false teeth either. So we'll go ahead and go to review systems. So first, Sharon, I'm gonna just get an overall questionnaire form, or just ask you a bunch of questions about your overall health.
Okay.
Do you have any headache right now?
No.
Any fevers?
No.
Any chills?
No.
No. Are you tired or weak?
No.
You just feel really weak. You don't want to do anything. Okay.
No.
So none of those. We'll go into more about the face. Do you have any ear pain? Any ringing in your ears?
No.
Okay. How about your nose? Do you have any congestion or sore nose?
No.
Or runny nose?
Mhm.
Do you have any tenderness right here?
No.
These areas? So no sinus pressures that we notice. Okay, so your eyes, have you noticed any abnormal drainage, any tearing, double vision, blurry vision?
No.
Okay, any vision changes that you
No.
notice? Okay, and just to go back, have you had any hearing changes recently?
No, I hear pretty good.
Okay.
I hear pretty good.
And then do you have any sore throat? Any difficulty swallowing?
No.
Any bleeding that you notice when you brush your teeth or?
Not that I know of. No.
Okay. Do you have any chest discomfort? Any chest pain?
No.
Any chest tightness?
No.
Any shortness of breath?
No.
Okay. And then have you noticed any lumps or abnormal swelling in your neck?
No.
Okay. No pain?
No.
Let's see. Do you have any difficulty breathing?
No.
Okay. Any coughs? Any cold recently?
No.
Fevers? Okay. Do you have any nausea, vomiting, any diarrhea, constipation,
No, I don't.
any abdominal pain, any changes in your diet recently or hydration?
No.
Okay. And your urinary flow is normal?
Mhm.
Okay. What color would you consider your
I would say yellow.
yellow?
Yellow
Okay.
clear.
Okay. Do you notice any like foul odor or any really sweet smells?
No.
Any frequency burning in that area when you
No.
eat? No.
No.
Okay. Any vaginal discharge, abnormal vaginal discharge that you've noticed?
No.
Okay. And then your bowel movements are regular?
Yes.
Okay. And you have one every 3 days, right?
Every day.
You have one every day.
Not every 3 days.
Okay, so you have one every day.
Yes,
Which is,
yes.
Okay, which is good. No liquid movements or anything.
No, no diarrhea.
Okay. How about your skin wise? Do you notice any swelling, any bruising, any bleeding that you've noticed?
No, I don't notice that. No.
Okay. Any joint stiffness, any soreness that you've noticed?
No.
Okay. Any I don't see any deformities, but you've never broken a bone before, right?
No.
So we've gone through like a generalized head to toe for review of symptoms. Next, I'm going to go into the actual physical assessment. Just so that Sharon can see me, I'm going to go ahead and wash my hands. Okay, Sharon, I'm going to go ahead and do an actual physical assessment on you.
Okay.
So first, I'm going to look at her hair and her head. And I notice no lumps, no bumps. I don't see any bugs. Her hair is evenly distributed. So that all looks good. It's asymmetric and atraumatic. It's symmetrical and atraumatic. Okay, so next I'm going to go ahead and look into her ears. I'm going to take the otoscope. So first, face me. If you could see her pinna and her external ear looks really good. It looks healthy. I don't see any abnormalities or any bleeding like that. And her other ear is just the same. Oh, and for the purposes of this video, everything I do on one side, I would replicate on the other side in a real patient. Okay, so first I'll show you, we'll go ahead and look into her ear to begin with. So I see her tympanic membrane is nice pearly gray, a little bit of Kierman noted, and I see the cone of light, which is at 7 o'clock. Okay, so since I have the light on still, I'm going to go ahead and look at her mouth. And I already noticed that her mouth has no lip swelling. So Sharon, go ahead and open your mouth. Okay, very good. I don't see any bleeding in her mouth. Go ahead, stick out your tongue all the way. Say Okay. Now move your tongue left and right, and then up and down. Okay. So there's a couple of things that I look into the mouth first. So first I notice the gum line. There's no bleeding in her gums. I don't see any cavities in her mouth. Her tongue moves well, so her cranial nerve 12 is intact. When she says ah, I see a uvula of the midline, and I don't see any swollen tonsils. I don't see any cobblestones in the back of her throat. And then for the purpose of this video, I'm not going to gag her, but I would test the gag reflex. And so her gag reflex is intact. And since we're also in the mouth area, I'm going to go ahead and check her cranial nerve number 5, first 7. So go ahead, puff out your cheeks. Okay, don't let me push them in. Okay, close your eyes real tight. Don't let me open them. Okay, now open your eyes. Now I'm also going to check her TMJ as well. So her cranial nerve number 5, her transmandibular joint. So is there any tenderness when I feel
No.
it? Okay, so open and close your mouth. Okay, I don't feel any popping or cracks. Since I'm also here, I'm going to feel the back of her ears, her mastoid bone. Does that hurt you at all?
Nope.
Okay, so no tenderness. And since I still have the light, I'm going to go ahead and do some eye ocular movements as well. So Sharon, go ahead, look across the room and keep just stare it over there. Now I want you to look at right here and across the room. Okay, so her accommodation is good. So Sharon, go ahead and keep staring at this. I'm going to move and check her cardinal directions. Make sure her cranial nerve 3, 4, and 6 are intact, and which they are. And we also did, and keep staring right here. And we also did the Snellen chart earlier, so her vision, according to the MAs, is 20/20. So I don't have to worry about that part. I'm also looking at her, I'm also looking at her external eyes. I don't see any abnormalities, no swelling, no redness, no drainage. I'm also looking at her sclera, and the sclera looks fine. Sharon, I'm going to go ahead and pull down your eyelids a little bit, and her conjunctiva is nice and pink on both sides, up and down. I don't see any redness or any yellowing of her sclera either. Like I said earlier, her iris is nice and round. I don't see any gray halos. Her pupils, they're both equal and they're both reactive, or they're both round. And we're going to check for reactiveness for her light. So Sharon, go ahead, keep staring across the room. I'm going to shine some light at your eyes. Just keep staring. Okay. So her eyes react, and they're both consensual. So they both, here, keep staring naturally. Okay, so yeah, they're both consensual. So her eye movement is good. So next I'm going to look at her nose. And for her nose, it's nice and straight. I don't notice any crookedness or any, looks like she had any broken nose before in the past. And I don't notice any septal deviation either. And they both sound, she doesn't sound congested at all. I saw a little floating thing, that's why I grabbed it. Natural reaction, I'm really sorry. Anyway, so going back to the nose. To her nose. So no septal deviation. She doesn't sound congested. So Sharon, I'd like to see if your nose are pain. So go ahead, close one side and breathe in. Okay, good. Now do it on the other side. Okay, so both sides are patent. Both nostrils are patent. Next, I'm gonna tap her forehead and her cheeks and her nose just to check for any sinus pressures, and you let me know if it hurts you.
Okay.
Does that hurt you?
Nope. No pain.
No pain that we notice. Okay, so she no sinus pressures. So next, I'm gonna look into her nose to look at her turbinate, and we'll see what we find. Okay, so you ready? Yeah, thank you for in her nose. So no arrhythmia, no redness. Her mucosa is nice and pink. No arrhythmia, no, her mucosa is nice and pink. No drainage that I've noticed. So her nostril looks good. Her nares look good. So next I'm gonna go for the otoscope. Not the otoscope. I'm gonna test her hearing reflex. Her hearing. The Rhine and Rubber test to test her hearing. First I'm going to do a bone conduction hearing using the tuning fork. And I did palpate earlier her mastoid bone to make sure that it is normal. There's no tenderness upon palpitation. So in order to activate the tuning fork, I'm going to go ahead and hit my elbow. Actually, first, Sharon, I'm going to explain to you the procedure. Okay, so first I'm going to put this on the back of your bone, and you let me know when you stop hearing it.
Okay.
Next, when you stop hearing it, you let me know, and then I'm gonna have you hear the tuning end, the fork end,
Okay.
and you let me know when you stop hearing that.
Okay.
Afterwards, we're gonna do kind of a similar test, and I'm gonna put the fork right up here,
Okay.
and then you let me know if you hear more on one side versus the other.
Okay. Sounds good.
And both these is the Rhine and Rubber tests.
Okay, stop. Okay, stop.
Okay, so this is normal. The air conduction is longer than the bone conduction, which is what we want.
Okay, here on both sides.
Okay, so she doesn't have any hearing loss in those ears. So next I'm going to use the ophthalmoscope, and I'm just going to check for red reflexes on her. Okay. So Sharon, go ahead, stare straight, and sorry for the bright light in your eyes. Okay, both eyes have a good red reflex. Okay, you can relax. Okay, so next we're going to go through the neck. We have the neck portion. We're going to feel the back of the neck first, and what I'm feeling for is the occipital lymph nodes, and then right here is the occipital, and then the post-cervical, and then the pre-cervical. No tenderness, no pain?
No.
Okay.
No pain.
And then the post-auricle, then the pre-auricle, submandibular, the mantle, no pain?
No pain. No
Okay.
pain.
And then the supraclavicular nodes.
No pain.
No pain?
No pain.
Okay, and then I'm going to feel her for her thyroid. So go ahead and swallow. Okay, so her thyroid's not enlarged or anything. Next I'm going to check her range of motion and strength of her neck. So first I want you to turn your head to the left, turn your right, up and down. Okay, good. And then tilt left and right. Okay, good. So now we're going to kind of do the same motions but against my hand.
Okay.
So turn. Okay, good. Turn this way. Good. Now tilt your head left. Okay, turn your head right. Okay. Now push forward. Okay, and now pull back. Okay, good. So she's got good strength and good range of motions. I'm also going to check her shoulder shrugs. So go ahead, shrug your shoulders. Okay, don't let me push them down. Okay, so her shoulder shrugs, her cranial nerve is intact. Okay, so next we're going to go ahead and do her chest and her anterior and posterior torso. So first, I look at her breathing. I don't notice any increased work of breathing, no accessory muscle use or any type of retractions. I don't see any nasal flaring or anything. So we're going to listen to her. First I'll couple of things to also note. When she breathes, you could see that they're symmetrical. When she breathes in, it doesn't go in, and if she exhales, it doesn't puff out. So it's symmetrical. And I also don't see any bruising or anything. Now, when I listen to her, I'm going to listen to both the cardiac and the pulmonary systems together. So first, we'll listen to her right upper lobe right here. If you go to the second intercostal space on the right of the sternum, that's where the aortic valve is. So first I'm going to listen to that with my diaphragm. And when I listen to it, I'm going to try to listen for S1 and S2 is what I expect to hear, and a clear lung sound of the right upper lobe. Next, I'm going to go to the left side of the second intercostal on the left side, space down, and that's your pulmonic valve. And what I'm listening for that one is your left upper lobe. So, and then next would be the third intercostal space down, which is your Erb's point on the left sternum border. And then the next one's your fourth, which is, this whole section right here is your left upper lobe. And then the fourth one is your tricuspid of the fourth intercostal left of the sternum is your tricuspid valve. And then your mitral valve is the fifth intercostal space midclavicular. And then that area is also the point of maximal impulse. So it should be louder. And then also your left lower lobe. For the right lower lobe, I would go back down. I would go back to the right side. So I would go right, left, down, and then back over. And then when I go back over, I'm listening to the right mid lobe, and then I'll go down to the right lower lobe down here. Okay. So I'm not gonna go ahead and with when I listen to Sharon, usually what I'll do too with a regular patient is that I'll have them breathe in and out per lobe section, so that way I can hear whether there's any sounds. But for the purpose of this video, I'm just gonna demonstrate the locations. Okay. And I'll do one test. Okay, so go ahead, breathe in and out. Okay, nice and clear. No adventitious sounds. S1 and S2 is heard. So here's the Erb's point, the tricuspid. No, aortic, pulmonic, Erb's, tricuspid, and then mitral. Okay, and then so here's the right upper lobe, left. When I go down, I just also try to listen to any other sounds that I hear. But her sounds are nice and clear. There's no adventitious sounds, no wheezing, no bronchi, or any of that. And then I'll show you the right mid lobe, right lower lobe, and then here's the mitral, which is also the left lower lobe as well. And then next I'm going to listen to her cardiac locations with the bell side. And this one will let me hear any type of S3 or S4 or any type of murmurs or gallops. Which I don't hear any of those. Okay, so next we're going to have Sharon turn towards me more. And actually kind of really towards this way. Yeah. And as she turns, and what I can do at the same time is see if her AP diameter, which is normal. I don't see any barrel chesting. I don't see any pigeon chesting. So next we're going to look at Sharon's back. I'm gonna walk over on this side. As you can see, again, she's breathing normal. So I would also listen to her lobes on the back side. So we got the right upper, left upper, and then the right lower. Now the right lower lobe, sorry, this side. Okay, so this side's the right, left, uppers. And then the right mid lobe, you can't really hear it from the back, but this section right here is her right lower lobe, and this part is her left lower lobe. So I'm going to go ahead and listen to those as well. And then we'll also do the respiratory excursion, diaphragm excursion. We'll also do Fermatus, and since we're on the back, I'm just going to do a CVA tenderness back here too. And again, I'm just going to show you where the locations are, and then in real life, I would have a patient breathe with each location. Breathe in and out. No. Hold on. Try that again. Okay, nice and clear. No adventitious sounds that I've noticed. Okay. We'll kind of go down. These are the lower lobes. And then we'll just do the side lobes just to make sure I didn't miss any sounds. Okay. So next is the respiratory excursion to see if they're symmetrical when she breathes in. So I'll put my hands down here. Go ahead, breathe in and out. Okay. So it's nice and symmetrical on both sides. Next, we're going to go ahead and do her diaphragm excursion. And so Sharon, breathe all the way out, and I'm going to tap on your. Okay, so right here is about her end, her bottom. So go ahead, breathe in all the way. Okay. Okay, so right here to right here. So we got about 3 centimeters, which is normal. Go ahead, breathe normal. Sorry. Okay, so which is 3 centimeters, which is normal for a diaphragm excursion. Next, we're going to go ahead and do a tactile Fermatus. Okay, so every time I put my hands on your back, I want you to say 99, okay?
Yes. 99, 99, 99.
Okay, you go ahead, stop. And so what I'm looking for is any type of vibration that might indicate any type of fluid in her lungs. Okay, next is the CVA tenderness, just to see if she has any kidney stones or any kidney infection. Does that hurt you?
No.
Okay, so she's not bouncing off the table, which is what we want. Okay, so Sharon, go ahead and turn back around to the front. Next, what I'm going to do is check for her pulses. So I'm going to listen to her her carotid pulse for any type of bruits. Okay. Which I don't hear any thrills. I mean, I don't feel any bruits or any abnormal or any like abnormal thrills. Anyway, so next we're going to go to the peripheral for her radial pulses. And they are 2+, which is normal. They're not bounding, they're not weak. So since I'm down at the arm area, I want Sharon to go ahead and give me a good strong handshake. Okay. And then I'm going to cross my fingers and put my fingers in both and go ahead and squeeze real hard. Okay, good. And this one tests her strength for her hands. And since I'm down here, I'm going to check her skin turgor. And her skin is nice, warm, dry, and intact. There is no tenting noted, nice and moisturized. If you could see, her nails are also very, the shape and the contour are both are equal, and they're healthy looking. They're nice, kind of shiny. I don't see any rigidness or anything like that. I'm going to go ahead and check for capillary refill. It's instantaneous in less than 2 seconds, so that's normal. I don't see any clubbing on her hands. I don't see any skin issues either. So next I'm going to check her Tino test and then a flangel test. So the flangel test I'll do for at least 1 full minute. So go ahead, I'm going to tap on her her wrist. Does that hurt you in any way?
No.
No tingliness, no numbness?
Mm-hmm.
Okay, so I want you to go like this. Yeah, push against it. And then, do you feel any pain?
Nope.
Okay, so there's no pain there, and then in real life I would do this for a full minute. Then this one tests for carpal tunnel syndrome. Okay, so go ahead, relax. Okay, so I'm going to check your range of motions for your fingers. Okay, so spread them out all the way, and then close them, and do the same thing, relax your fingers. I'm going to do the same thing with my fingers in between, so squeeze real tight. Okay, and open them, try to fan them out. Okay, which is really good. So for her thumb, go out for adduction. Okay, in for out. Okay, down. Okay, so flexion and then extend, go up. No, your finger, yeah, fingers go up. Okay, good. Okay, so her thumb is good, her hands are good. So next I'm going to do the wrists. You don't feel any pain? Mm-mm. Okay, so next I want you to pull your hand up and then down. Okay, which is good. And then we'll also check her brachioradialis deep tendon. So relax your hand. Okay, so that's normal. All right, so next I'm going to check her strength for her elbows. So go ahead, go like this, fighting position. Okay, now go against resist me, okay?
Okay.
So I'm going to pull, I'm going to push. Okay, both of them look good. Go out and in. Okay, so for her elbows look good. You can put this arm down. Relax this one. Mm-hmm. So this one, I'm also going to check for her brachial deep tendon reflex. Okay, which is good. Next, I'm going to do her tricep. So we're going to go to the back. Relax your arm.
Okay.
Take a deep breath.
Yes.
Deep breath in and out. Okay, there you go. So that one was normal. So next, I'm going to check her shoulders. So go ahead, put your arms in front of you. Okay, don't let me push you down. Don't let me push down on me. Okay. Okay, now hold 2 cans and then go ahead, empty them out. Any pain? Any tenderness? Okay. So relax your arm. Okay, now for the shoulder. One of the tests I would like you to do is try to scratch your back. So what you do is one arm above and one arm below, and you might try to meet them in the middle. Okay? And they meet. So go ahead and do the other side. And this goes for the internal, external flexion of the shoulder. So those are fine, they're normal. So next would be the apprehension test. So go ahead, put one elbow up. Okay. And then try to rotate backwards. Okay, does that hurt you at all?
Nope.
Nope. Okay. So next is a drop arm test. So go ahead, open your arms like a T. Oh, I'm sorry. T? Okay, now slowly bring them down. Okay, so you don't see any quick movement or anything like that, so it's normal and intact. So that's our shoulder range of motion and in elbows and hands and wrists. So Sharon, our next portion would be to go ahead, lay down on the table. So next I'm going to do an abdominal inspection. Okay, so first I'm going to lift up her shirt to do an inspection, to look. And I don't see any scars, any stretch marks, I don't see any bulges or masses or any hernias. So next I'm going to palpate her abdomen. No, I'm going to auscultate her abdomen. So what I'm listening for is any type of gurgling. And while I'm there, I'm also going to listen for her aorta. For her aorta, and then any type of bruits for the aorta bruits, and then you got the renal, the iliac, and then the femoral. So I will listen to all that while I do all this. Okay. So right upper quad, left upper quad. Bowel sounds are normal, normal active. And then I don't hear any bruits. Let's go to renal. Nope. And femoral. Those sound normal. So next I'm going to do a palpitation, a light palpitation, and Sharon, you let me know if it hurts you in any way.
Okay, right.
So I'm just doing a light palpitation to see if she has any type of guarding or anything like that. Doesn't hurt you?
Nope.
Okay, so next I'm going to do a deep palpitation, and this time I'm going to actually try to feel for her liver. I'm going to try to feel for her spleen, and then her lower quads as well. Okay, you ready?
Yep.
Okay. Does that hurt you?
Nope.
Take a deep breath and relax. Let it out.
Yeah.
Okay. All right. So I don't feel her liver at all, or her spleen actually. Okay. So next I'm going to try to palpate her kidneys too. And this one you go underneath the her back and then top, and then you try to feel if you could feel anything. And I don't feel anything. Okay. So next I'm going to do the Murphy sign. So I'm going to push down on your abdomen.
Okay.
I want you to breathe all the way out, and you let me know. Breathe all the way in. Any pain?
Nope.
Okay. So next is the psoas sign. Put your shirt down. Next is the psoas sign. I want you to lift your knee up. Okay, and push against my knee. Push against my hand. Okay. Does that hurt you in any way?
No. No.
Okay. So there's no pain there. And since I have her knee up, I want you to go ahead, bend it all the way down, and bend it all, straighten it all the way up, and do the same thing against my hand. Okay, and up. Okay. So her knee strength is good. So next I'm going to do the obturator sign. Go ahead, turn a little bit to your left. Okay. And so I'm going to kind of internally abduct her hip, and I'm going to bring her leg out. Does that hurt you at all?
No.
Okay. So I'm also going to hyperextend her hip. Okay. So go ahead and bring it back. Okay. Does that hurt your hip at all?
No.
Okay. So since she's on her side, go ahead, relax. Since she's on her side laying position, I'm also going to feel for her PMI. And I would normally do this for a whole minute. And it's like I said, it's that right lower sternum area. Okay, and feels good. No abnormal bounding. And then since I have her on her side, I'm just going to go ahead and check. I'm going to have you see her Achilles reaction. So go ahead, relax your knee, relax your dead weight your leg. Okay. So there. Okay. So it works. It's fine. It's intact. Okay. So go ahead, go back on your back. And since her neck is kind of like her body's kind of in a 45-degree position, I would normally measure her JVD at this time, but for the purpose of the video, I'm not going to do it. So go ahead and let's do some more hip range of motion.
Okay.
Okay. So let's go back and bend your knee.
Okay.
I want you to frog leg your hip.
Okay.
Okay. Does that hurt you in any way?
No.
Okay. Internally rotate and then forward and then down. Okay. Didn't hurt you at all?
Nope.
Okay, next I'm going to do her knee, and you let me know if you have any pain, okay?
Okay.
So relax your leg.
Okay.
Okay, so I'm going to do the varus and valgus. Does that hurt you at all?
Mm-mm.
Okay. And next I'm going to do a Lachman's test. So I'm going to kind of send your thumb too heavy, let me know.
No.
Okay, so I'm gonna push against her shin, so that one's fine. And I'm gonna do the anterior drawer test. So that one works too. Alright, that one's intact as well. No pain?
No.
Okay. So go ahead, sit back up. Yeah, go ahead, put your legs at the side and kind of scoot yourself. Yep, let your feet dangle. Okay, since she's dangling her feet and I'm kind of at the knees, I'm gonna also do the patellar DTRs too. Okay, so that one's normal. Next, we're gonna go down to her ankles, and I want you to first. Does this hurt you at all? No. Okay. So I want you to lift up your feet. Okay, push down. Okay. Now inside, pigeon foot a little bit. There you go, and then push out. Okay, good. So her range of motion for those areas are good too. So next, since I'm also down here, I'm gonna relax your feet. Okay, relax. I'm gonna feel for her pulses. So her posterior tibial pulse is normal. And the same thing with her pedal dorsalis. And so they're 2+, they're not bounding or anything. Next, I'm also gonna check for her plantar reflex. Okay, so there you go. So she didn't fan her toes out like a Babinski, which I would see in little babies. But her plantar reflex is good. Next, since we're doing kind of a neuro check, I'm also going to do a sharp and dull senses.
Okay.
Alright, so I want you to first look. This is going to be a sharp,
Okay.
and then this part's going to be dull.
Okay.
So I want you to close your eyes, and you tell me which one's which.
Okay. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull.
Oh.
Dull.
Okay, I think we got 20. Alright, so go ahead and relax. So our sharp and dull senses are good. Next, we're gonna go ahead and do a vibration test on her. So again, I'm just gonna activate it with my elbow. Okay, you let me know if you can feel it, okay? If
Okay.
you have any pain.
Yes, I felt it.
Okay.
Yes. Yes, I felt it. And yes.
Okay, so those are normal. Okay, next we're gonna do her cerebellar functions. So go ahead and we're gonna do a little bit of test. I'm gonna put my finger here. I want you to touch my finger, and then touch your nose, and go back and forth. Okay, good. Relax. And then, so we're gonna do some rapid alternating movements. So kind of copy me with your hands. Okay, great. Relax. Next, I'm gonna want you to do a heel shin maneuver for me. So I want you to go like this, down, up and down your heels and shin. The same thing on the other side. Okay, wonderful. Relax. Go ahead and stand up. Okay, next, close your eyes. So this is the Romber's test, so that she's not in balance or anything. Go ahead, open your eyes. Okay, next I want you to walk all the way back to that couch over there. And her gait is normal. Stop and turn around. When you come back to me, I want you to walk on your heels up to the table. And when you stop there, turn around, walk on your toes. Stop there, turn around. Now this time I want you to do a tandem walk, so which is kind of like a heel toe idea. Okay, and both of those are nice and intact. Okay, now go ahead and stop. Okay, now I'd like you to take a bow for the camera. Okay, so here I'm going to check for scoliosis and kyphosis, and she doesn't have anything, it's nice and straight, so go ahead and stand up. Next I'm going to have her do a shallow knee bend. Go ahead and curtsy for me. Well, it's not really curtsy, that's okay.
Yeah.
Shallow knee bend. So so she's intact in that way. So this is Sharon. She's a healthy female, and I don't see anything abnormal with her physical assessment. Thank you so much for coming and helping me with my video.